Welcome to Below the Line with Dr. Bennie L. Harris. The Chancellor of the University of South Carolina Upstate talks with top leaders about issues such as change, technology, education, and leadership. Please enjoy.
Okay, welcome to Below the Line. Below the Line is a monthly podcast that I do with a very distinguished leader. Today I have Phil Feisal, who's the president of Spartanburg Medical Center. Phil and I go back at least 3.5 years when I came to USC Upstate. And it's a division of Spartanburg Regional healthcare system, and it's playing a strong economic development role and an important role in our region, particularly in Spartanburg County. Phil, I would like to start by saying welcome.
Thank you.
And then I would like to start by let's go back in time.
Okay.
Where were you raised, and what did you want to be when you grew up?
Well, first, let me say thanks for the opportunity to be with y'all today. I'm really looking forward to this. And I will note, Bennie, that last month my role changed a little bit. I'm still president at SMC, but I'm also now the CEO of the hospital group.
Oh, great.
So all 5 acute care hospitals are.
So that's a promotion.
It is a promotion.
Yeah, it's a promotion.
Right.
So congratulations.
I'm at that age I was actually looking to slide this way. I'm unfortunately sliding with a few more years ahead of me. So I'm originally from Memphis, Tennessee, not far from where you grew up.
Right.
Born and raised there, the son of an academician. My father was a microbiology professor and ultimately retired as the vice president of academic affairs at the University of Memphis.
Okay.
So he was in higher education administration. I began my journey towards healthcare administration really relatively early. Where I went to high school in Memphis, we had a class that we had to research a career that we were interested in.
Okay.
My junior year, so 11th grade, and now this is pre-internet days, so it was limited. I was going to the library. Right, I was going to the library. I was sending off information. I was interviewing people, and I had been interested in the science. Well, I'd been interested in healthcare.
Okay.
And then I got introduced to the sciences and realized I was not going to go down the path of becoming a physician or a nurse. I just didn't. The sciences and I did not agree very well, even though my father was a microbiology professor. I couldn't even spell microbiology back then, right? And so I studied as I did my research. I studied hospital administration as a career in 11th grade, right?
Okay.
And so I just decided to go that direction, and graduated high school, went to the University of Memphis, which was then Memphis State.
So you did an undergraduate degree in finance.
I did.
But
I knew as soon as I finished my undergrad degree, I wanted to go to graduate school and study hospital administration.
Okay.
And so I thought finance was a pretty good avenue for me at that time. So I was relatively focused. I went to the University of Memphis, or again, then it was called Memphis State. My father was in administration there. It was easy because it was a free tuition and free housing,
right?
And so that made it really easy to choose that as an option, knowing that I was intending to go to graduate school immediately following.
And you did your graduate work at the University of Alabama, at
UAB,
Birmingham.
yeah.
So that's another connection we had.
Yeah, that's right.
I did my graduate work there as well.
That's right. I forgot about that. So I was. Back then, this is the mid-'80s, there weren't a lot of hospital administration or health services administration programs across the Southeast, and I was interested in staying in the Southeast, largely because I was dating my college sweetheart who became my fiance during graduate school, who became my wife now of 36 years.
Congratulations.
Thanks. And so I looked just in the Southeast at programs and really narrowed it down to 2 schools, and UAB being one of them.
Okay.
And Medical College of Virginia, which has another hospital administration program of some esteem at that time. And the UAB choice was closer to Memphis, and they gave me scholarship money. I mean, I was kind of at that point in my life that whatever support I could get, and they offered me a research assistantship.
Excellent.
And so I was able to. They had a coordinated degree program. It allowed me to get an MBA, which is what everybody was getting in the '80s, right?
And they had
Reagan
they
years.
have a world-class hospital.
So I got an MBA and a master's in public health with a concentration in healthcare policy and organization, and then took off from there. In my first job, I went to work for a for-profit system that's no longer in existence, but it was a large system at the time, and they came on campus and recruited.
Okay.
And because of the how renowned that program at UAB was, we had folks come in looking for graduates. And I took my first job in Chicago at a hospital up there, and big system who said, look, you go to Chicago, and we got hospitals all over the Southeast if you ever want to come back. And so went to Chicago, progressed in my career, Athens, Georgia, following that, and then Augusta, Georgia, and then moved here 30 years ago and went to work for the Greenville Hospital System.
Has it been that long?
I've been here 30. I've been in the upstate for 30 years.
30 years?
Yeah.
Okay.
Yep. 30 years.
So what lessons did you learn in from those experiences that brought you to Spartanburg?
Well, I worked at GHS for, pre-Prisma, right?
Okay.
GHS for about 14 years, in two roles in particular, and one of which was kind of in the managed care sphere, and then ultimately became the president of the hospital out in the Greer community that is now transitioned. It was Allen Bennett Hospital, relocated and rebuilt as Greer Memorial Hospital. And then from there, I went to work at St. Francis for a couple of years as a vice president of operations before I came to work at Spartanburg Regional. I by no means being braggadocious, but I'm the only individual that's been in executive positions at all three of those. Yeah, I'm glad it's worked out at Spartanburg Regional because I got nowhere else to go. At this point,
if you want to stay in the upstate,
if I want to stay in the upstate, exactly, and I do, right. But I went to work at GHS. I got recruited over to St. Francis, was there for a couple of years, and then the previous CEO at Spartanburg Regional knew I had done some work in Greer with Allen Bennett, and they had just opened up the Pelham Hospital. I think you've been out there. I know you're familiar with it. And the CEO at Spartanburg Regional at the time, a fellow named Ingo Angemeyer, called and asked if I'd be interested in coming out there to. And I had I'd worked in hospitals, but I never had been part of a startup. Okay. And I thought the challenge would be at that point in my career really interesting. And so I was out there for about 3 years. And then kind of quickly made my way down to the main hospital, if you will, the Church Street campus.
So what thing, from a leadership perspective, or a couple things that have guided your career or these experiences?
The work that I do is largely relational. Okay. Right. It is, and has been kind of from the start. I mean, I think the success that I feel like I've had in leadership and continuing to advance in my career is largely tied to the relationships that I've developed. Okay. The opportunity at St. Francis opened up only because a number of physicians that I had worked with at GHS were at St. Francis. The opportunity at Spartanburg Regional opened up because I knew the CEO from some South Carolina Hospital Association activities. And so I think that relationship component is critically important as we advance our careers. Look for mentors. Look for folks that can help you get to where you want to go.
I think that's important. I know it's important. Yeah. And I have a wonderful opportunity to try to instill that into students here at the University of South Carolina Upstate, is that networking and relationships are so critically important, not just for learning, but for advancing your own personal careers as well.
That whole concept of social capital is real, right? And it gives you opportunities to, and for your students, the more they can get exposed to people and more they can get exposed to opportunity, the greater opportunities that will present for them.
I do want to say again, thank you, because I've sent a couple students your way to say, can you talk to them about careers? I sent my son your way, and you have spent time talking with him and a few students at USC Upstate, and you've always been extremely gracious.
Well, I appreciate that. From our perspective, from my perspective personally, it's easy to go back 30 years when I was starting my career and been given opportunities to meet with people, to understand how their career got to where they are. It's amazing, and I have an opportunity to teach a class every spring at Wofford, a healthcare policy class that I've done. This will be my 12th year, and I really enjoy the students there.
Right.
And we bring in some guest lecturers. Trey Gowdy comes and speaks to the kids, the students. Ed Sellers, who's the president of Blue Cross Blue Shield, will come and talk about health insurance. Thornton Kirby, president of SCHA, and to a person, they'll tell them what I tell them, and that is, you look at where you're sitting right now. You're probably going to find when you're my age, when you're Thornton's age, when you're Trey's age, it was a pretty circuitous route to where you are. I mean, it's one thing to feel like you've got it all figured out. It's a whole nother to actually have it figured out.
Right.
And so, I try to tell students, as I know y'all do here, is try to get as much exposure to things as you possibly can.
That's important.
It may not be a straight line from where you are today to where you think you're going to be.
Very, very rarely you have a straight line.
Yeah.
I think people are going to change careers several times. So let's talk again about Spartanburg Medical Center.
Yeah.
It's been known, I think I have this
Yes,
right, as
yes.
a safety net provider.
That is correct.
In the community. So why is that important? And what else can you tell me about the organization's effort to improve access to health care for uninsured and underserved populations?
That's a great question. We do we are considered a safety net hospital.
Okay.
What technically is a disproportionate share hospital.
Okay.
So in essence, across the country, there are hospitals that take arguably a disproportionate share of as a community hospital, take a disproportionate share of all the care that's provided here. Now, until
You still have to be profitable, though, right?
we do, yes, yes, and I do think folks realize that we don't have any state or county tax money. We have to operate managing our, just like y'all do here, managing our revenues against our expenses, and it's incredibly important for us now. It always has been, but since 2019, when we purchased Mary Black,
Right.
right,
And I want you to talk about that a little more in terms of the process for that acquisition. But
we became the only healthcare provider, inpatient hospital provider in the county.
Okay.
So even prior to that, we were a disproportionate share hospital and a safety net hospital, easier term. That ramped up even more so when we couldn't look across the street and say, okay, well, there's somebody that's going to provide that service if we don't.
Okay.
We are they now, right?
Okay.
And so in the three counties of Spartanburg, Cherokee, and Union, we are responsible for all the hospital beds.
Okay.
That makes us responsible for the care provided there in those respective communities. We don't look to anybody else to make sure that happens. More specifically, to answer the second part of your question regarding our involvement in the community, we've got a number of programs. You may be familiar with our Access Health program,
Right.
which connects folks who are underserved with providers, and not just providers anymore. Bennie, we're responsible in the federal government. CMS continues to kind of move towards these social determinants of health.
Right.
Responsibilities for healthcare providers,
Okay.
and so it's not just you come in the hospital, we take care of you, but it's do you have food? Do you have housing?
Yeah.
Do you have transportation? Are you in abusive situations? So that becomes a part of what we do, and so we try to connect now folks who might find themselves in a less than desirable situation. Okay. We tie them to resources that are our resources or others. Yeah. We're big supporters of the St. Luke's Free Medical Clinic.
Okay.
One of our vice presidents is the chairman of the board over there right now. We invest in the community in a lot of different ways.
So with you being a safety net hospital, I'm sure you have to put a lot of effort in preventive care and helping the population understand how to stay out of the emergency room, which drive costs up.
No question about it. In fact, that's the most expensive place that you can access care. Now, mind you, we're one of the 5 level 1 trauma centers across the state. We've got responsibility to take care of those who come into our emergency department for any condition.
Right.
But for those who don't have a primary care doc, if you come to our emergency department, it's a more expensive way to take care of an earache, right? So we do have responsibility of educating folks on where's the best place to access care. Now, mind you, and you know this as well as anybody does, this county's growing by leaps and bounds. I mean, we're the second fastest growing county in the state. You've seen the numbers. In the next 18 years, they're expecting another 100,000 people to move to Spartanburg County. That'll get us near 500,000 people. We have dedicated our responsibility to that in expanding our capacity.
Okay.
I mean, there are folks that have a hard time finding a primary care physician right now, and we think we're responsible for making sure that changes.
Okay.
And so we're in a process right now of kind of running through a strategic plan from a capacity perspective.
Right.
And when I say capacity, I don't just mean we're adding that primary care docs or surgeons, but we need to add hospital beds in our community. We know that the beds that we have today are full, and as the community grows, we're going to be responsible because there's nobody, like I said, there's nobody else doing that. We're the ones that are responsible for doing that. So we're undergoing a process right now to ensure that we have the beds we need to take care of the folks. The fastest growing population in the state, in the county, is the 65 plus.
And that age is probably one of the most expensive population.
Not probably.
It is.
It is the most expensive by a long shot.
Beginning of life and end of life.
And again, that 65 plus by a long shot. A lot of folks have found this a desirable place to retire to. We've got to make sure we've got the resources to take care of them as they come here.
So when you made a decision to acquire the 207-bed Mary Black Hospital, then I think in Spartanburg,
yes,
the 125-bed facility in Gaffney and other physician offices, how do you go about making that type of decision?
Well, I'll back you up a little bit. So just prior to, we purchased them in January of 2019.
Okay.
Right, January 1st, 2019. In 2018, early 2018, Community Health System, CHS, parent company, out of Nashville, where your son lives, and where y'all were, they made the decision to get out of South Carolina altogether, right?
Okay.
So they came looking for suitors, and they had 6 hospitals in the state. We ended up purchasing 2 of them, Mary Black here in Spartanburg, what was called Mary Black Gaffney is now Cherokee Medical Center, and then MUSC picked up the other 4.
Okay.
We had just gone through a process of working with some architects, some national architects, on how do we build more beds on our Church Street campus.
Okay.
And it was, we had designed a 10-story bed tower. The destruction, if you will, of our old Church Street building, and which nobody really wanted to make happen, but it was sitting in a place that we needed to rework the campus. So we needed beds. Well, the decision to pick up Mary Black gave us beds immediately, right? Immediately. And so we were able to secure that relationship with CHS such that on January 1st of 2019, and it allowed us then to slow down the bigger project of building beds on our campus, and the idea of having a second hospital here in Spartanburg was very appealing to us.
Okay.
Yeah.
So there are many challenges facing healthcare and hospital systems these days, everything from staff shortages to cybersecurity. What are some of Spartanburg Regional Health System biggest challenges these days? What are your strategies for mitigating some of them?
The biggest challenge that we face, and we're relying on you educating strong students that want to join the workforce locally, is workforce development.
Okay.
We're as you kind of already indicated in the prologue here, I mean, we're an economic engine in this community. We've got over 10,000 employees, but at any given moment, I've got 800 open jobs.
Okay.
I mean, almost 10% of our jobs are open. And so as we came through COVID, which was a challenging period for all of us, you at universities, I sit at hospitals, and even small retail. It really just had an incredible impact. we found ourselves in a situation where the workforce shrank significantly. A lot of nurses left the field altogether, and we made a commitment coming out of there in a 3-year plan to make workforce development a strategic cornerstone for us, and it is still our biggest challenge, right? So this past year, well, no, this earlier this year, I should say, we developed a system-wide position, a system-wide director of workforce development, professional practice, and innovation.
Okay.
She's working with y'all here at it's Shelley McMillan, who you've probably met. She's working with folks at USC Upstate, but we've also decided to move down the chain even further and get into the high schools.
Okay.
So that young folks can realize that there are opportunities in healthcare and opportunities beyond just, unless you've grown up in a medical family, you know what a doctor does,
Right.
you know what a nurse does, but you might not know what a pharmacy tech does, and you might not know what a CT tech does. And so we're exposing our all the districts in the community.
In an earlier podcast, I talked with
Yeah.
Alan Smith,
Yeah.
who is the CEO of One Spartanburg.
Yes.
And then he talked about the talent gap.
Yeah.
And I know that Spartanburg Regional Health System has, 300 interns from high schools?
So this summer, One Spartanburg Inc. is committed to 400 interns
400,
across the county.
Right.
We're going to take care of a quarter of those.
Okay.
These are going to be paid internships for high school students, to high school and college students to come work at our hospital and learn different components of what we offer.
1/4 of those interns is a big commitment. Is
It's a
that
huge
in
commitment.
response to the 10% workforce?
It
that you
is.
constantly
It is.
hire?
I mean, look, we believe in what y'all do here as a regional university. I mean, the majority of your students are from the pretty close to around here. We think most of them will want to stay in the Upstate.
Okay.
There's so much happening in the Upstate that it makes sense for us to build that pipeline local. And so from the perspective of the work we're trying to do around workforce development, it is a huge local effort. We've gone out and tried to recruit in places like Florida and Virginia, particularly around nursing.
Yeah.
We've had limited success. They may come, but a lot of them will end up kind of making their way back to their home state after some period of time.
Okay. So you talked earlier about teaching at
Yes, sir.
Wofford University. We talked about mentoring.
Yes, sir.
So I have a specific question that I learned about something that
Yeah.
you do in terms of mentoring students from Wofford particularly. In one case, you gave a student time with more than 15 leaders in the Spartanburg Regional Health System
Yep.
to give him an understanding of everything from oncology to food service.
Yep.
What do you like about serving as a mentor, and why do you think these experiences are so valuable to
Well,
students?
I again, as a maybe wannabe educator myself. Again, my father was an
I guess
academician.
you have that influence
My
already.
father's father, before he immigrated from Lebanon to the United States, he was a college professor.
Okay.
And so it feels like it's in my blood a little bit. But I just think it's important. I mean, I had mentors when I was in school. When I was in graduate school, Benny, the research assistant I worked for was a fellow named Jack Duncan at UAB. And he was an organizational dynamics guy. And so I learned, and I did a lot of the research as he put articles together. I did a lot of the research for those articles. And I learned a whole lot about how organizations work under his mentorship. I mean, he really exposed me to that part of the equation. And I feel like we need to, as successful individuals who have an opportunity to share, we need to do that. What you described, Wofford's setup, they've got an interim every January,
Right.
And so that young man you're talking about, we actually have every year we'll have a student who will do their interim with us during that January period for those days, and we've had several of them have gone on to pursue. I've had two of my students go on to UAB as a result of my years there to graduate school. But I've had a couple of your students that have come over and spent some time with us. We've hooked them up as they're interested in hospital administration as well. I just, for me personally, and this is not a professional commitment or desire. Personally, I enjoy making sure that next generation is prepared, and anything we can do to make that happen, I'm in full support of.
I understand you are an avid cyclist, ultra runner,
Yes.
hiker.
Yes.
So what drives you in these activities, and where are some of the favorite spots to ride, to run, and hike in the upstate?
So that's a good question. I like structure, and while I was high school athletic, I college and graduate school took me away from that, and when I moved to Athens, Georgia, I met some guys that were running, and I thought, well, I'll try to pick that up, and I did. So I've been running for 35 years. I've been cycling for about that same period of time, and Benny, for me, it's become a early morning activity. My favorite part of the day is before everybody else is awake, and so I've had a group that I've run with for some of them for almost 30 years, and it kind of balances me in a way that, look, I don't golf, I don't hunt, I don't fish, but I do like to spend my time in the outdoors in a different way than maybe others. Yeah. My wife and I love to hike. Cycle all over. Northern Spartanburg County, Northern Greenville County, Western North Carolina. I've had opportunity to travel the globe running. I've ran a 62-mile race in Switzerland, ran a 50-mile race.
How do you run a 60-mile, 2-mile?
You just start running. You just Forrest Gump. It's
kind of like Forrest.
I just started running.
Forrest, run.
Run several 50-milers out west. With a collection of guys that that we enjoy kind of time together, and my wife and I have hiked Wicklow Way and in Ireland. We're hiking Mont Blanc next summer with a group of folks, and so anyway, my spirit is rejuvenated in the outdoors, and love that.
So let's talk about this. Podcast is entitled "Below the Line."
Yes, sir.
And that was done intentionally. Yeah. As you think about leadership, and it's almost like the image of the iceberg.
Yes.
You don't really know what's going on below there, but you're trying to make decisions about what's on top. Right. How do you lead below the line in your capacity?
That's a great question, right? And so I think you've got to know your people.
Okay.
I mean, I think it's very important, and as I said early on, the work I do is almost exclusively relational, right? Benny, I don't know that I'll ever be the smartest guy in the room, but I try to always surround myself with people that I know are experts in their respective areas.
Okay.
And I try to ensure that we hear from all of them on an issue that might be not as obvious to all of us at the moment, but make sure everybody has a voice, so that we can make decisions as a collective.
So how do you respond to that voice, that dissent from where you think you should go?
Well, I think most importantly is allowing the voice to be heard, right? And then secondarily, you've got to put people around you who understand that. As an example, I've got a handful of vice presidents that I work with that have very distinct responsibilities within the organization. I've got a team of folks that we may have disagreement in the room, but when we walk out, everybody understands where we're going to go, and I think that's critically important, because it can be so. It can fracture an organization so quickly if there is a dissenter who takes that dissent outside of
outside the room.
Absolutely. And so we try to get clarity around where we're going to go and what we're going to do on issues. Now, mind you, I will say from March of 20 to even into early 23, COVID made that really hard for us because nobody knew it. I mean, we had never faced that before, and so we had some really hard conversations in the room at times, and it probably brought us together better than anything we've done before as a group. Now, I'm not going to be shy to tell you we had at least one individual who just couldn't keep up with what we were doing that left the organization during that period of time. A senior leader who just, look, it happens in organizations, right?
Yeah, it happens.
That it just there was too much of a challenge, and it was unfortunate. Now we're a better organization today because we've done the things we need to do to work well together collectively.
Okay.
I think part of that, though, Benny, is we've got folks that know each other, right? That respect each other, and it, as I said before, I just want to build a team around us as an organization that can work together well, that trust each other.
Right. And an important part of leading in that space is being able to listen and invite them to have conversation.
Absolutely.
You have to do
that. Look, I've there's a couple things I've told them. I've got 3 children, 2 boys and a daughter. But my 2 boys, as they were starting out in their careers, I've informed them that it's a lot better to use your ears than use your mouth. As you get started in your career, and to listen. And to get to know people, I do think as well. And this happens in healthcare a lot. There's the traditional kind of rub between administration and physicians. Right. Now that's softened a little bit because most of the physicians are employed these days. But I never enjoyed having the first conversation with a physician about something that I thought they needed to correct.
Right.
That I didn't know them first, right?
Okay.
I mean, so ideally you want to get to know folks, have a relationship with them before you have to have a hard conversation with them.
Yeah, and you started out with that when you answered the question. You said you have to know the people that you're a part of. It's just like knowing your patient. I think in the hospital you have to.
Absolutely.
And you have to listen to your patients.
Absolutely.
As well.
Absolutely.
So, Phil, tell me, do you have a hero?
Well, I would, look, it's the easiest answer. But my father. I mean, he really was. He passed away a few years ago, at age 89. He was a strong man that I've tried to emulate a lot of my life. I actually did the eulogy at his funeral, and they kind of opened up the church to let anybody who wanted to speak about their experiences with my father. Okay. After the eulogy, and Bennie, I had left Memphis in 1986. So I've lived away from where he was all those years. The stories that I heard, he was already my hero. He became even more of a hero. Yeah. I mean, the things that he did for folks that were maybe noticed only to them. Yeah. And so I have always fashioned him as the person that I most admire.
Yeah, it's kind of like an old song we used to sing in Mississippi. Made the work I done speak for me.
Yes, yes, and he was that guy.
Yeah. So, how would you describe yourself as a leader, and how do you think others would describe you?
I think the most important attribute to a leader is authenticity. Okay. That when they tell you something, may not even be what you want to hear. Yeah. But they're truthful. Okay. And that you are believable in what you do. And I try to lead that way. And I actually think that the folks in our organization, I want to be a steady hand. I mean, there's plenty of people that get wound up and Look, you and I both are responsible for large groups of people. I don't enjoy the drama.
Yeah.
I try to stay pretty even.
Right.
I don't get too excited both with a win, and I don't get too torn up about a loss.
Yeah.
And I think folks would describe me as relatively even. And the other thing that I have found critically important in my role is I'm not in my office very often. I mean, when I have to be, I am. But generally, my joy is out in the hospital amongst the folks and making sure that folks have what they need to do their job.
I have a mantra that I say, leadership is about absorbing chaos,
Yes.
projecting calm, and giving
Yeah.
hope.
That's
So I think
beautiful,
the organization
actually.
really want
Yeah.
to have that, even in the midst of whatever
Yeah.
the financial leadership.
Yeah.
COVID was a good
Yeah.
time for that. So what is your mantra? What mantra do you have?
I think my favorite quote would be that, and from a work perspective and from a non-work perspective, Maya Angelou's. I've learned that people will not remember what I said nor remember what I did, but they will always remember how I made them feel.
Yeah.
And I think that's, look, we're in healthcare, so that's critically important with our patients and their visitors. I think it's equally important with our staff, right? I mean, to ensure that, regardless of what your role in the organization, and if you think about our organization, I mean, we've got folks who may not even have their GED,
Right.
and we've got folks who have, are physicians with three
Doctors
specialties
and three
behind them.
right.
And they all are such important, have such important roles in the work that we do. And I think it's important that we, nobody wants to come to work and do bad. We want to make sure we create an environment where folks are happy at work and doing good work.
So Phil, thank you, Phil.
Yeah.
Thank you so very much. I'm here with Phil Feisal. Thank you so very much for spending time with me on Below the Line. Phil is the Chief Operating Officer for Spartanburg Health System and the President of Spartanburg Regional Hospital.
Correct.
So thank you so much for spending time, and looking forward to our continuous growth together as two important institutions in this region.
Bennie, thank you so much. I've really enjoyed it.
Thank you.
See you.
The Below the Line podcast is brought to you by the University of South Carolina Upstate. Look for our monthly write-up in Greenville Business Magazine, and for more information, go to uscupstate.edu.